everybody who has joined the webinar. Thank you so much for joining. We have an exciting discussion topic today that I think all of us in healthcare, and most importantly, folks in post-acute care, feel a lot of burnout around, which is around how do we all communicate together in the most effective way, collaborate together, and take care of our patients. So the discussion topic is interdisciplinary collaboration, which we believe is, if as you will hear from Dr. Esther and Aaron, I will dive into a little bit. It's kind of like you can gain superpower if you can figure this out. It would be an amazing superpower to have to do so many things, including and most importantly, unnecessary hospitalizations. So thank you everybody for joining. Let's jump in and do a quick introduction by Dr. Wester. Dr. Wester, you want to introduce yourself real quick?
Hi, I'm Dr. Rebecca Wester. I'm a geriatric specialist. I've been doing this for 25 years. Um, I my practice is in Omaha, Nebraska, but I practice across 5 states, bringing geriatrics care to long-term care facilities, whether it's private homes, nursing homes, or assisted living.
Great. Thank you, Dr. Wester. And then we'll jump into Aaron. Aaron, you want to introduce yourself?
Yeah, sure. I'm Erin Lutzinger. I am a director of nursing at Rose Blumpkin Jewish Home here in Omaha, Nebraska. I've been in nursing for 24 years, primarily geriatric nursing, which is my love, passion. And I'm enjoying my role as a director of nursing. Lots of challenges in senior care or providing senior care. And we're going to discuss one of those challenges today. And I'm looking forward to being here with all of you.
All right, fantastic. A little bit about myself. I'm the co-founder CEO of Hucu.ai, which is first of its kind patient-centered communication. We call it intelligent communication. So we'll talk a little bit more about that. So let's dive into what are some of the learning objectives. There are two really. One is how interorganizational, different organizations coming together, collaborating in the most effective way or does impact high quality care. That's one piece. And I think the other thing is some of the practical tips and best practices that Dr. Wester will share and Aaron will share in how do they do that to get to a high quality care. So so let's dive in, and the discussion topics, the different things we'll talk about are, so we'll first talk about what are some of the biggest challenges in delivering great care and in post-acute care, specifically in facilities or communities, and what is Dr. Wester doing in building a great interdisciplinary team, and followed by how is Dr. Wester and her team are able to support the nursing staff on a day-to-day basis across all these different facilities, and some practical techniques and best practices for quality communication. And then lastly, we'll look at how Dr. Wester and Aaron kind of achieving their team goals. So let's just start first by talking about what are the biggest challenges to delivering great care in senior living and SNFs. So first, Dr. Wester, maybe you can talk a little bit about before you started implementing, because you bring not only bring like amazing strategies and techniques and tools and technology, you think about this differently than a lot of the other providers. So can you talk a little bit before, like maybe go back a year or two when you saw these challenges, and then one by one you started to address them a little bit. We can get to it later. But what are some of the challenges that you see in the industry today in delivering great care?
Thanks. I'm going to give you some background on the 4 pillars I have for decreasing ER and hospitalizations. The challenges are acute change of conditions, increasing and maximizing the skill set of the facility nursing staff, med reconciliation, making sure everybody's on the same page for their medications, and when able, address polypharmacy. I know families have and residents have opinions about stopping certain medications. And of course, the 4th pillar, which is goals of care. And so that is the foundation of my secret sauce, how I can have to combat challenges and decrease ER and hospitalizations. Where Hucu comes in is that communication, that's just the number one biggest challenge. When things break down, the number one thing is always there was some kind of lack of communication, miscommunication, and we really strive to get everybody on the same page and communicate. In long-term care, the standard of practice for communication is phone calls to the doctor or a
Right.
fax. Phone call you don't get that rich data and assessment because you're just doing it on the fly and it's gotten to the point of a crisis situation. So you may not have all the tools because you're on a timeline. You got minutes to decide what to do. Faxes, oh my goodness, it can take up to 2 weeks to have that fax communication go back and forth. HIPAA compliant communication is key in this day and age. And so that's one of the things that I just love about Hucu. It's HIPAA compliant, it's texting, it's super easy, and it's HIPAA compliant with pictures. Pictures are worth 1,000 words.
Got it. Thank you. Thanks, Dr. Wester. So I think the challenges that you're describing are, there are things that happen in the facility, which is like you mentioned, the 4 pillars, which is, you mentioned acute change in condition, MedRec, polypharmacy, improving the skill set and goals. And all those things are unique to kind of each patient, right? And if you have 100 patients, then you have 100 different possibilities of acute change in condition. You have 100 different possibilities of MedRec, and MedRec actually is 100 times maybe another 10 or 20 because everybody's on 10 to 20 different meds. So it's an exponential problem to keep everything synchronized. So I think what I'm reading in what you're saying is one of the biggest challenges is keeping everybody synchronized, and these pieces, the 4 pillars that you talk about that are super important in reducing hospitalizations and ER visits, is to make sure that the teams are everybody's organized with respect to different patients and what's going on. And then it really breaks down when it comes to communicating. There's an acute change in condition, you send a fax, forget about it, right? Or if you make a phone call, the information can be missed, or if you send a text, then it may not have all the right information. Okay, no, that makes a lot of sense. So that's kind of like your perspective. Erin, you want to share a little bit about what you have experienced in the past, like before before you started leveraging or working with Dr. Wester, and her ways of collaborating, I think, is different than probably what you have experienced in the past. So can you talk a little bit about challenges that you see going on currently in the industry and what you faced before you started collaborating with Dr. Wester?
Yeah, I sure can. So again, thank you for having me. It's my pleasure to be here speaking to everyone today. As healthcare workers, I think, especially in the senior care setting, we're always looking for ways to improve patient outcomes, provide the best care that we can to our senior population. It doesn't really matter what level of care you're working in. When you're working with seniors, I feel like over the years, it's changed so much. The old, 12 years ago, independent living has now kind of turned into assisted living. Assisted living has turned into more of skilled level. And skilled level, really, we're seeing patients that almost look like they're a stable acute care level.
Wow.
So it's the evolving healthcare. Patients are more sick than they were, 10 years ago. So the rehospitalizations is such a hot topic. It's very disruptive on residents. It caused setbacks, delays in the healing process, just back and forth to the ED, or back and forth for inpatient stays, risk for nosocomial infections, medication errors, deconditioning. So there's just that's just to name a few. So we all know that this is a big issue. And then it interferes with the care that we can deliver, with the quality. It's very costly. We're not within regulatory practice if we have people going back and forth to the hospital, and we're clearly not able to provide the best care we can. We teamed up with Dr. Wester. I think, Dr. Wester, it's going on 2 years. This March, it'll be 2 years.
All right.
And that has made a tremendous impact on the care we provide, because you can't get anywhere without that collaboration. Like we've been talking about, collaboration between different healthcare agencies, the hospital, skilled facilities, AL facilities, if that's where some of your residents are admitting from, and collaboration with your physicians. And Dr. Wester, you have to have, with the population becoming higher acuity and more medical needs, you have to have that direct oversight and clear communication and collaboration with your physician. And that's what Dr. Wester provides. Some of the things that we've implemented in our own building, early goals of care meeting, care plans that outline interpersonal goals, desires, early discharge planning, reviewing medication face-to-face, patient education from each discipline, weekly therapy meetings. And then Dr. Wester provides a practitioner that rounds in our building twice weekly, which is very helpful, because then you have a lot of involvement from that team, that medical team, a lot of oversight from that medical team. And then I personally, with Dr. Wester, she's brought along the Hucu text messaging application, which has also been huge. And I truly think that improves our care. It provides day-to-day easy communication, which is key. It's practical. Sometimes, especially with newer nurses, I fear that maybe they're afraid to contact the physician, and we still have to push that education and have their critical thinking skills built up before they're comfortable. This is easy. Everybody carries their phone. We're a society of technology and texting. They can quickly send a text. And then what happens with those interactions, if the physician or Dr. Wester or team member need more information, they will kind of cue the nurse on the other end saying, well, what about this? Did you look at this? Can you send me med lists? So it's just a super easy communication tool between the provider and the floor nurse. It decreases the risk of communication errors because everything's written out so they can go back and refer to previous texts. It provides me, as the director of nursing, I can oversee that thread. And I can go back and say, hey, we could have possibly provided this information, or when did this communication start? It's just kind of a way to track. It's a great tool, and you definitely need that physician oversight to help mitigate this issue that everyone is having.
No,
Our
thank you,
team,
Erin. Go ahead, Dr. Wester.
our team is brought in. It becomes addictive to have prompt responsiveness from my medical team. Our standard expectation for my team is 30 minutes. And typically we are answering the facility's needs within minutes.
Yes.
And you get used to that level of responsiveness, and it really goes a long way, because the other part of great care is the customer, the residents and their family. Something something happens, and if the nursing staff can do an intervention immediately and tell the family, well, we contacted the medical team, we contacted Dr. Wester, it goes a long way for excellent care with the residents and the family. And the
Huge.
other thing is also, as Erin said, she's DON. She shadows all the clients' threads. The other team members on there is also the IP, the infectious preventiveness, and
Mhm.
NDS. So when we come up with a new diagnosis, it can be added right then to NDS and PCC, the platform for the facility.
Yeah, and
Yeah,
I
I
know
think
that, oh, I'm sorry. I was just gonna say
no, no, go ahead, Aaron. Yeah.
it spoiled our staff a little bit, because I'm telling you, they will come down. The thread response from Dr. Wester's team, like she said, is usually within a minute or two. And if they don't hear back in 5 minutes, they'll be like, is something going on? I haven't heard back. I'm like, it has been four minutes. Let's give it some time. So it's really improved the communication. I mean, I couldn't go back any other way, because this is just the way our building runs now and how we operate, and it's improved the communication.
So if I sum it up, I mean, if you guys are looking at the screen, like what is your practice doing in building great interdisciplinary teams? I think what I'm hearing is that it's the essence of supporting each other in a timely manner is really what really builds great interdisciplinary teams. You know, it's like if the nursing staff has a question and they know they can go to one place and get an answer in minutes, that's the beginning of a great relationship. That's like gives me trust. It allows me to feel good about what I'm doing. Because I think there is a lot of pressure, right, in on the nursing staff, like about taking care of all these different patients. Like, what if this patient, like we talked about, there's an acute change in condition here, or there is like I want to have these questions about these meds, or what if something gets missed, or the patient starts having problems for which you're gonna now have to send them. So I think there's a lot of pressure, and they're not there. The nursing staff cannot really make a lot of the decisions, as we know in the industry, right? They cannot order meds, they cannot do so many different things. So that's where the provider's role is so important, to be there, whether in person or virtually, to be able to support that team and get them what they need. Because if you give them what they need, then they are much, I think, relaxed. And Aaron, you can probably talk a little bit about that. They feel less burnt out. They're not chasing, the doctor again and again, few minutes that you talked about. And I think once you build that bridge, that's like really a beginning of a great relationship and a great team, because everybody knows that the other side is there to help me in a matter of minutes. So, did I kind of summarize it correctly? I think that's kind of like just timely support is really what
Yeah.
helps build trust and everything.
And you do mention trust, and also this is a safe space. If the nurse doesn't understand one of our orders, they can reach out, or if they have a different opinion. And my team and I, we do in time, rapid education. If we are stopping a medication, we put the reason why, because that's a frontline nurse who has to talk to the family member. And we also go into other discussions, such as, this is my differential. I'm doing this lab to rule out this, this, and this. And, for the time being, use X medication until we're rounding, in person tomorrow. And so I feel like that little extra for my team goes a long way to make it a safe space that they can, if they don't quite understand, my thinking, they can reach out.
Yeah.
No,
I know,
that
from
that
being a
yeah, go
floor,
ahead.
sorry, I keep interrupting you. I'm sorry. I was just saying, just from being a floor nurse 10 years ago, sometimes if you knew something just wasn't quite right with a patient, but you were a newer nurse, or you didn't have enough to call the physician, so you were a little nervous and a little hesitant, we don't do that. I mean, with Dr. Wester and her team, our nurses will just say, hey, something's not quite right. They just seem off. And then that'll prompt a whole conversation between Dr. Wester and her team and our staff that could potentially get to the bottom of something brewing. So that those lines of communication, which you can't function without, are just completely open. So, and it also helps us stay in compliance, because I know Dr. Wester, if somebody is complaining of urinary symptoms, then you guys will go ahead and attach the S-bar if our staff haven't initiated that. So then therefore they complete the S-bar, and then we're staying in compliance with antibiotic stewardship. Or we can flag certain things to revisit at a later date, or help us track on our end, like behaviors, falls. There's just templates. So it's clear, concise communication, which is what you need to get the job done.
Yeah, so I think as we are as the discussion is going, I think you already covered some of the things like how the nursing staff on a day-to-day basis kind of gets the necessary support. Um, and with this, I think and more, I think for Erin, I guess is the question. Have you seen like because it's day to day you would kind of experience, because you walk into a lot of skilled nursing facilities or assisted living communities. Everybody's very, very busy. Nobody has time, and everybody's running around, and they're all stressed out. Do you think, like with Dr. Wester's strategies, your nursing staff is, maybe I won't say relaxed, but maybe satisfied with their day and how it's going? Because not only they're getting fast response, so they can take care of their patients, they feel good about it. That's why they're in the profession in the first place. But Dr. Wester and team are also educating them. Hey, this is why we're doing this. This is why this is the way we were making this change or whatnot. So kind of upscaling them in a little bit in a better way. So who doesn't mind like learning new things? So you think all those things are kind of making your nursing staff feel more, satisfied when they come and do the work?
I mean, I would like to, I hope so. I believe so. We get very positive feedback from our nursing staff. Um, they're involved. They understand, because Dr. Wester does a really good job of outlining expectations if we have certain situations in our building that arise. When the staff understands that and can preemptively or proactively provide her with the information that they know she's looking for, then they feel like they're doing things right and per protocol. And I think that sets the staff at ease. I feel like great interdisciplinary team work hinges upon three things. This is my opinion: communication, education, and competency. And as Dr. Wester mentioned, she provides a lot of that educational piece through the thread by just simply saying, okay, you've had a fall. Are they on blood thinners? Have they had any recent medication changes? What are we looking at? So our team gets that educational piece with the medical director's involvement. And I think that absolutely helps our team function just more smoothly and at ease. They also, because of the oversight in our building, and they're familiar with the physician assistant that comes in, they can anticipate that. So they say, hey, when so and so comes in on Tuesday or tomorrow, can you run this by them? Can we revisit what was on the thread and kind of go back from? So it just, I think overall, yes, it does, and it just improves our communication throughout our entire
That's
facility.
fantastic. That's
Mhm.
that's great. And I think if you have a new nurse coming in, or when you first started it, how difficult was it? I think Dr. Wester touched upon it a little bit, but it'll be great to hear from you, Erin. Your nursing staff using Dr. Wester's approaches, Hucu as one example. How easy was it for your nursing staff to come up to speed real quick, or how long it took them? Was it difficult, hard, easy? to start to use Dr. Wester's like Hucu or technology or processes?
It's very, very simple. And people love it because you don't have to have that face to face, but you still have very effective communication. So you don't have to, if you're a night nurse at 1 a.m., you don't have to fret on calling the physician. Like she said, we also exchange, we'll put pictures on there of different wounds, and it's really kind of like a real-time assessment. So it's very smooth. Effective communication. And I think that people catch on very easy. We don't have any issues. We have the iPads available at each neighborhood. It's extremely easy to use. Everybody text messages. And the work is kind of done for you because, like I said, she'll pop up different templates or forms. And basically, it's just ongoing communication. It's also helpful. I forgot to mention, but this is huge. Like I mentioned before, as director of nursing, I do follow the thread, and it helps me know what's going on in the building when I don't always have time to round and go face to face with people. But if you haven't worked in a neighborhood for a while, yes, you have a written out report sheet, but you can go back on the thread and look at
Mhm.
communication for months back to say, oh, we did this, or this was the last fall. And it's just sometimes easier to look at that instead of going into the computer and digging a little bit deeper. You can get like a snapshot of the patient care. So I think that has also made it very easy for the nurses.
Got it. And what were you doing? And same question for both of you, Dr. Wester and Aaron. Since you're talking about this, what were you doing before using Huku, which is like a patient-centered communication going on? What were you doing before that?
We were doing all paper. Our medical director would come in and write a note, saw a patient on this day, looking at, that was the communication. We'd have to go in and somebody would track on paper a visit, and then we would go in and read a progress note and a chart. And then call when we needed specific orders or change of conditions. You'd have to call an office. And if that office was closed, you'd usually get an on-call provider that sometimes
And
doesn't
how
always.
long was your team getting responses at that time before Dr. Wester?
Oh, that's not even comparable. Like sometimes it'd be 24 hours. I mean, if you had an urgent situation, you could push it through a little bit faster, but nothing beats the communication we have now.
Nothing like Dr. Wester's 5 minutes.
Nothing. It's not even usually 5 minutes, Dr. Wester, about a minute.
Your nursing staff is kind of ruined in a way. They cannot go work anywhere else. And maybe that's a good
Yes.
thing, Aaron, because they're
Yeah.
wherever they
Yeah.
go, they're like, okay, this sucks. I'm going back to Aaron and Dr. Wester because I get my job done faster.
Yeah.
That's funny. So I think the practical techniques as we're talking about is which we talked about. I think if you don't have communication is like you do face to face, and for forever the invention of communication, you communicate face to face, and then later on technologies like phones and voicemails and faxes kind of came along, in the past I think 100 years, and we're a lot of us are still using that, but in the fast-paced environment, I guess you need something faster. So, you text came along and everybody knows how to text. But the problem with text is not HIPAA compliant. You cannot share PHI, and information is all spread across different kind of, so if I text Dr. Wester, only Dr. Wester sees that I texted. Everybody else is kind of lost on what Dr. Wester and Asif are talking about. So I think Dr. Wester's approach and obviously Huku as a patient-centered communication is what we're talking about, is gives you the ability to, when you need to have the face-to-face, there is provider on staff in the building a few days. So you have that. And if anybody has that question, they can just post it. And that kind of creates that instantaneous educational as well as response time to support the nurse's questions. So I can get my answer, and I also get some advice on why am I doing this, what Dr. Wester is telling me. So I learn a few things. And then I think, Aaron, to your point, if I am a new nurse or I come in at a different shift or I'm assigned a different set of wing or a neighborhood in a community, I don't have to kind of block people's time to kind of, okay, tell me what happened to this patient in the past 3 days or 4 days. I can just go to one place and get educated, not only what the questions were from the last nurse and what Dr. Wester answered or suggested and taught, and I'm just now upskilled myself. So in a way, it's kind of like a team that's really come together, learning with each other in real time without waiting for somebody to call back or get an answering service or whatnot. So if I think, did I kind of summarize how what are the ways I think you guys are using? Okay, great. So I think anything we missed, because we're a little bit over, we're just 1 minute over, so we can probably wrap this up. What are some of your, I think, team goals, and how do you plan to achieve them as we kind of start in 2025? Maybe you both can talk a little bit about that.
I'm going to keep Hucu is always one step ahead of us, and things that we can add to my practice to enhance communications and do better care than what we're already doing. We're looking into virtual visits after hours, check-ins. Um, One of the things that I haven't mentioned yet is that as a practice, I get communications from outside vendors, whether it's a specialist like cardiology, pharmacy, and also insurance carriers. Where it's a new year, I'm getting all these faxes on so and so medication isn't covered. I can post that on Hucu, and that will give it to the nurses, and they immediately call pharmacy, and then we change the medication. And so it doesn't have that financial burden to the family. And so this is also a great conduit, things that are coming through my medical practice that we can do in real time.
Right. Dr. Wester, one of the things I think and this is kind of like, I think part of your, goals also has been, you talked about the pharmacist or specialist or other people. You can bring those into different patient channels and start to communicate. That's one side of, I think, the growth potential is.
Yeah.
And I think the other also is to, because in Huku, there's a patient family mode where you can communicate with patients and their families, but they cannot obviously see the care team discussions. So I think those are some of the things that I think inherently you're kind of mentioning, that do you want to explore, kind of push improving your or streamlining your communication with not just with the nursing staff, but also with the pharmacies outside, specialty pharmacies, and also communicating with the families.
Yes, I've brought hospice in for individuals who are on hospice. And so that's also a coordination with an outside agency. And yes, I have to dive into that family and friends channel. That's on the to-do list.
Yeah. Aaron, from your side?
I would say the same. I mean, with all of the regulatory practices and the federal, state, local regs that are coming down the pike, and healthcare just evolving and always changing. I mean, my goal is just to work on continued communication, collaboration, guidance under Dr. Wester. Everything just gets a little bit more involved, and we just are always kind of revising and reviewing our practices and policies. And our goal is just to continue to do that, to stay the best we can and try and get the best patient outcomes we can, which I think is everybody's goal. But we're just in it, and the goal is to continue to grow upon it.
That's
Always
fantastic.
improving.
Right. One of the things that we are seeing, I think, which is gaining traction is remote patient monitoring. Have you, and because there are, I'm not an expert, so, but what I'm hearing is there are different things that are coming up. I think there's long-term ACOs that are coming together and kind of organizing and putting more proactive care on for these seniors. And then the other is remote patient monitoring. What are some of your thoughts on those types of arrangements?
I'm already looking into it, and it's like a surprise for Aaron.
Yeah. Dr. Wester always has something new for us. So yes, and we're always open to new and innovative ideas. So I've looked into it myself, and I'm not an expert and I haven't taken a deep dive, but I know it's right there. So
Yeah,
Yeah,
the ACO
one thing
High
I find.
Ridge is coming next. Yes. And then our RPM already picked out a vendor. That's for 2026.
okay.
That's fantastic. Yeah, I think one thing that's really unique, or yeah, I think it is there. I think both of you, as like we say it takes two to tango, right? Um, you're both like feed off of each other. Like, you Dr. Wester has an idea, Aaron, you're there, like, yeah, let's try that. Let's see if that makes our nursing staff and our team's lives better. So I think that's one of the biggest, I think, key takeaways. I mean, you can try to implement the technologies or the processes or whatnot, but if the two sides, they're not on the same page with respect to progressiveness, innovation, thinking outside the box, trying different things to make things better, you can put in, NASA's technology, even though it's not applicable. I'm just, exaggerating, but it's still not gonna work because the people
Yeah.
are not, or working with the same wavelengths. So I think really commendable to see how you both work together and implement different ideas quickly, or whichever way to kind of improve the lives of the seniors and improve your nursing staff. So that's really, really commendable. I wish we had more and more folks in post-acute care like you guys, because then I think that's when we can start to kind of move post-acute care forward into the future more effectively. All right, so we have, I think, just 5 minutes or something left, so I'll open it up if anybody has any questions. Um, we have few people moderating the chat. They are talking about, let's see. If there's any questions out there, let me open up the Q&A. All right, let's just. All right, I don't think there are any questions at this time. Um, oh, there is one question. Oh, good question. So one question is, how long does it, so Dr. Wester, if you have a new provider, or Aaron, if you have a new, nurse, how long does it take for that new staff to learn Huku or, start communicating?
I I mean, it's really no time. It's so self-explanatory. We have an iPad. On the back of it, we have the login. For confidentiality purposes, we just have those residents on that particular neighborhood that nurse is working listed. I mean, it's a user-friendly app, so all the names are listed. They just open it up and you press on who you want to communicate to, the physician or Dr. Western or team. And there it is. You'll see all the previous communication listed in text message form. So it's really just a matter of showing them the iPad, what the passcode is, and that's it. It's not really anything more than that.
So
My
you're saying
office
maybe at
staff,
max. Sorry, go ahead, Dr. Wester.
It takes longer for us to put the app on their phone and on their computer on my end and get them their password. I mean, I want to say less than 30 minutes, 15 minutes tops.
Yeah,
It's super easy.
it's super easy. I mean, we have nurses like on day 2 of orientation that are like, I can run the thread, or, I'll communicate with the doctor, and they're walking around with the iPad, and it's not even, it's a matter of showing them it. That's it.
Yeah. Yeah.
Fantastic. Any other questions? And I think if anybody else, great question. So thank you, Dr. Wester and Aaron, for answering that. If there are any other questions, we thank Dr. Western and Aaron for your time, and everybody else who joined this webinar. We will be posting it, I believe. So if you missed it, you will get to see it or hear it later on. Thank you, Dr. Wester and Aaron, for your time and really sharing some really simple and great insights into the way we can, move the post-acute care forward with respect to building interdisciplinary teams and collaborating. So thank you so much.
Yeah, thank you. Thank you for having me.
Thank you. Take